Hi, welcome everyone. Thank you for joining this session. In this session, we'll be discussing why it is necessary to address the health and climate nexus in the context of responsible recruitment. As many of you listening in will know, migrant workers' remittances provide an economic lifeline to many countries and hold enormous development potential in both countries of origin and countries of destination. Research has also demonstrated that remittances raise health expenditures and reduce malnutrition and child mortality rates, among other positive outcomes. Yet, despite these positive outcomes, with climate change already having visible effects on the world, we now face additional issues threatening the health and well-being of people, especially those migrating to work in countries with harsh climate conditions. Questions around the impact of climate change on migrant workers remains, however, underexplored. With migrant workers in the 6 GCC countries, for example, they account for over 10% of all migrants globally. Based on this fact, we'll be focusing on this region during this session, but of course, many of the issues that we discuss will apply globally as well. Hopefully by the end of this session, we will have covered more generally why we need to consider issues related to health and climate when talking about responsible recruitment, or when envisioning how responsible recruitment should look like or could look like. I couldn't think of anyone better placed than Dr. Barak Al-Ahmed to answer some of the questions about these, well, essentially existential issues. Dr. Barak is a research fellow at Harvard whose work focuses on air quality, climate change, and health in the Middle East. And he has extensively studied the effects of environmental exposures on the health of migrant workers. Thank you so much for joining, Dr. Barak. A first question that I have, and I'm sure many listeners have, is whether you could give us an example of how environmental inequalities interact with health disparities, just for us to understand better the nexus of these issues.
Right. Thank you so much, Sarah. So when we think of climate change, it's not just an economic issue or a political issue or just an environmental issue. Climate change is a health issue. So we have to center health around all the exposure that climate change can have on humans. So if we think about extreme heat, air pollution, or vector-borne diseases or extreme other events like hurricanes and things like that that could destroy the infrastructure, or food insecurities, or water quantity or quality of water, all these different exposures, they have an effect on health, right? But the problem is that it's always those with less resources that are worst hit. And when you think about less resources, you can think of it at the individual level. So these are the vulnerable individuals, or you can think of it from a community or a neighborhood or a county that have less resources to cope with different exposures from climate change and also to prepare or respond to emergencies. And you can think of it sometimes as developing countries versus other countries that have resources. So these could be worst hit by climate change. If you are well off and you have enough money, you could live in a place where air conditioning is available for you 24/7. That could deal with the heat stress that you might be exposed to during the very hot, extreme days in the summer. But there are other people who cannot afford to have this. So it's always important to keep in mind that there are people with less resources or communities with less resources that render them unable to cope with climate change exposures, and therefore they have worse health outcomes from climate change.
Right. Thank you. Thank you for that. You know, as you mentioned, climate change influences human health, but also diseases. And like you said, not everyone is equally at risk. Of all natural disasters, extreme high temperature events are considered the main cause of weather-related mortality, for example. You know, and with that fact in mind, I was just wondering, you know, which groups, especially in the GCC context, would you say are at increased risk to suffer from heat stress and other heat-related illness?
Right. So we're talking here about migrant workers. And let's just take heat as an example. I extensively studied the effects of heat on the health of the populations in the Gulf countries and in migrant workers. So migrant workers are at increased risk of heat-related illnesses for obvious reasons and for less straightforward reasons, right? So the obvious reason is that migrant workers work outdoors for extended hours, so that makes them more vulnerable to extreme heat. So this is the obvious reasons that we see migrant workers are more vulnerable to heat. But there are less straightforward reasons if you think about them. Let's look at the neighborhood, or let's look at the community. You can see that migrant workers cluster in areas that are deprived. There are no healthy food choices. There are no places that you could do exercise. And then if you could look at access to healthcare, they don't have preventive access to healthcare as well. So that's also another problem. And you could see also bad health habits starts to happen in these areas, because if you deprive communities from all the health resources that they could get, it becomes worse. So that's the neighborhood, that's the workplace, and also individual. They don't have access to interpretation services, for example, when they get to the hospital, right? So all these different things add all these layers, right, that can wear down the health of migrants. And then you have the workplace. Not enough protections for health and safety, not enough training for health and safety also. That's another problem. You have stress, you have bullying at workplace, you have long hours, low pay, financial stress, all these different, the kafala system as well, job restriction, you cannot change jobs. And there is a looming fear of deportation for any simple offense that you could make. So all these different things, they wear down the health of migrant workers. And then you get on top of that all the effects that the environment might have, and the extended hours that they spend outdoors and all the exposure that they get. So we have done a number of studies in Kuwait, and we have looked at the effects of heat on the risk of mortality, looking at non-Kuwaiti migrant workers and the Kuwaiti migrant workers. And then we found that on a very extreme hot days, there's an increase from 2 to 3 times of the mortality rate for migrant workers. But for Kuwaitis, we saw no effect. Same thing, we looked at dust storms, comparing dust storm day to a non-dust storm day, right? And we stratified. We looked at the migrant workers, we found 4% increase in mortality. Looked at the Kuwaitis, no increase in mortality. Same thing with COVID. We did a study that we looked at all the same. So we adjusted for your comorbidities, obesity, height, habits, whatever. We adjusted for all these baseline things. And we said, okay, let's look at who is more likely to have ICU admission or death when they get COVID. And the non-Kuwaiti migrant workers were twice as likely to die and get admitted to ICU compared to the Kuwaitis. We looked at excess deaths during the COVID year of 2020. There was 73% or 71% increase in the excess deaths for migrant workers. For the Kuwaitis, there was only 32% increase. That's like a huge difference. So everywhere you look, you see a health disparity between the Kuwaitis and the non-Kuwaitis, whether it comes from the environment, the individual, the community, or the workplace. There are different factors at different levels that at the end, you look at this and you're not surprised anymore when you see this. But keep this in mind, Sarah, that the migrant workers are younger on average to the entire population. So you'd expect them to be healthier, not even more vulnerable. But this if you think of it from all these different aspects in public health that we look at, there are different factors that will lead to poor health among migrant workers.
Right, but some might say, maybe it all comes down to, perhaps Kuwaitis being healthier than the migrant workers coming in. You hear these type of arguments sometimes that people coming from the outside might have different, might be built differently or can handle things differently. From a health perspective, how would you debunk such statements?
Right. So a population consists of different age groups, right? And in the developed countries, you see a lot of aging because of the advancement that we had in healthcare. So you'd expect to have more older population in the Kuwaiti population compared to the non-Kuwaiti population, right? Because the non-Kuwaiti population, they tend to be on average middle-aged and they're fit to work, right? So the worker population is generally almost always healthier than the overall population comparing on average. So this idea that Kuwaitis are healthier than a worker population that are middle-aged and performing physically demanding jobs does not strike me as the best explanation for things. I think the best explanation of things is that this middle-age category is going through a lot of factors that could affect health with no resources that could protect them, compared to another group that is on average older, okay, and have more comorbidities, believe it or not, diabetes, obesity, all these common problems that we have in Kuwait and in Qatar and Saudi Arabia, all these Gulf countries, they have this in common. But then you see these differences. So I would not have this as my conclusion.
Right. No, that's very, very clear and very important to highlight. I think, the disparities are just mind-blowing, especially when you unpack it in this manner. It just goes to show. And more on heat stress. It's clearly an important issue, but it's also an important issue for business. I read that it is projected to reduce total working hours worldwide by 2.2% and global GDP by 2.4 billion in 2030. And we also see greater awareness and action pertaining to especially heat stress. We've seen it, for example, manifest in bans on midday work, which is adopted by all GCC countries. So, it begs the question or warrants the question, what else can governments in the Gulf and what else can businesses do to create a safer and healthier work environments? So how do we create safer and healthier work environments when we already have, for example, the midday work ban in place?
Right. So let's just break this down into two parts from what I got from the question. So the first part is about loss in productivity, right? From heat. And the second part, we'll talk about the policies, things like the midday ban. So when it comes to loss of productivity, I know and I understand why a lot of people would like to think of heat stress as an economic problem. This leads to this much loss in the GDP, this much loss in hours, and you can put dollar sign this. But also health is important. What's the dollar sign that you're going to put for people who could lose their lives because they're working under unsafe conditions that involve extreme heat? What's the long-term effect on their kidneys that you do not see at the time, but you can get chronic and acute kidney injuries from being exposed to extreme heat? So all these different things, I argue that they need to be taken into consideration, and we shouldn't have this tunnel vision of looking at loss of productivity and the dollar sign that we put on the loss of GDP, because health is important. And I argue that if you are to consider health and life in general, loss of lives, and that could have much higher economic impact. That's on one side. Now let's look at the other side, which is what policies are there, right? What can we do? And just right off the bat, I need to be honest, there isn't a lot of efforts globally here talking about having a universal important heat standards, right? So the science is still lagging on this. There are a lot of good efforts. OSHA here in the United States, they're proposed something there. It's in the process right now. We expect to see this. We see states like California, for example, they have their heat standards, but this is an evolving issue. The Gulf countries, they adopt an easy blanket calendar-based ban on midday work hours. That is, for example, in Kuwait, starting June 1st until the 31st of August, workers cannot work between something like 11 a.m. until 3 p.m. or 4 p.m., right? So they ban these hours, and then that should protect workers from getting heat stress. But let's talk about the science. So for you to get heat stress, there are multiple factors that you need to look at. Number one, the temperature of the air around you, how hot it is, right? So that's the temperature that you check on your phone, the Celsius or Fahrenheit. But there's also humidity. If it is very muggy, very humid, you're going to feel more stress. And then there is air stagnation. If the air is stagnant, there is no breeze that could come, or wind speed or wind movement, then it will be harder for you to withstand the heat. And then there is solar radiation. Are you in shade or are you under the sun? So these are 4 factors. Add to that clothing. What are you wearing? Some people need to wear heavy clothes if they're doing certain jobs like construction or firefighting, right? So if you're wearing a lot of clothes, that would make it even worse versus if you're not wearing all of this. And then your metabolic rate, how much physical work you're putting. This would also determine how much heat stress you're being exposed to. If you're doing heavy work or you're doing light work or you're just like sitting there. And then there is acclimatization. Is this your first day in the job, or have you been doing this for a long time? If you've been doing this for a long time, you probably have more physiologic or better physiologic response. So these are 1, 2, 3, 4, 5, 6 factors that could determine your heat stress. The midday ban, Sarah, does not take into consideration any of these 6 factors. It just assumes that these 4, 5, 6 hours during the midday, sometime from June to August, will solve the entire problem. So what happens at, if it ends at 3 p.m., what happens at 1 minute past 3 p.m.? Does that mean you cannot get heat stress? Of course you can. What happens on May 30th, 1 day before the policy kicks in? Does this mean that you cannot get heat stress? Of course you can. So any effort to have a policy needs to be risk-based, science-based on all these different factors that put them all together into a heat standard that is specific to the condition workplace. So you need to have all these measurements around there. And people might say, oh, this is a lot of work. Why are we doing this? It's just, we need to have like a measurement for humidity and a measurement for solar radiation and someone that checks and looks and does all of this and that. Tell you what, we do this for other exposures. Benzene, for example, in factories, in certain, we do this. We already do this for other exposures. Why don't we do it for heat? And with climate change, it's going to be a bigger problem.
Right, right. No, that's very interesting. And I think a very important lesson to also businesses when they have, for example, the midday ban in place, to reconsider and revisit that, as it won't be having the impact that we would like to see, and it won't help, help raise the health and safety standards within the workspace. And it's interesting because when we discuss these issues, we look at, for example, workers that are already in employment. And with this information in mind, I was just wondering whether there are any preventative measures companies and governments, for example, in countries of migrant worker origin, that they can take ahead of the possible recruitment of workers. So can they better prepare these future employees And for example, can the health checks, the often obligatory health checks, can they play a constructive role in this? So wondering more on your ideas and thoughts on how do we prevent or how do we better prepare workers at kind of at the minimum level?
Right. So historically, health checks pre-employment, especially in the Gulf countries, have focused on transmissible infectious diseases for quite a long time. And understandably so, you don't want to import new cases that could result in an outbreak in the community. So you need to have some form of testing for certain infectious diseases for people coming to the country, right? But there is currently a need for a shift towards chronic diseases. And what could this mean for employees to work out? But prevention procedures, they don't only happen at recruitment. Think of it as a process. Like you have to do it before, during, and even after employment. So across the entire lifetime of the work process, that you can have all these different health checks. And these are important. But the problem that I worry about, and I worry about a lot, is the discrimination that you might get for people with disabilities. So if you go all in with all these health checks at recruitment, you might discriminate against people with disabilities despite their ability to do the work. So in the United States, for example, there is the Americans with Disability Act, and this act says that at pre-employment, you shouldn't screen out disabled candidates or just ask them if they have any disability. You should just ask them if they can do this certain job, right? And if they say yes, they can do this job, then you can give an offer. But you cannot discriminate on disabled people. You cannot ask, job applicant if he or she has any disability. They can ask how can they perform the job. So the examinations, health checks need to be job related and consistent with whatever business activity that is related, and not be discriminatory based on this.
Right, because the last thing that we would want is for these checks to basically screen who can stand the heat better than the other person. For example, in relation to heat stress, we wouldn't want to test people's boundaries or abilities, but rather ensure that at least there's some sort of awareness of the working conditions, that these working conditions are tailored to the risks involved and are reflective of the science that exists on it. So it's very interesting and important to note that, and also the risks involved in extreme screening, if you may. We shouldn't go into another extreme as well. Another question that I have based on this conversation, as you've very clearly stated, to address the impacts of climate change, especially on those most vulnerable, we need a coordinated approach, right? We need one that is intersectional in thinking and action. And based on this, IHRB has excitedly launched Gulf Sustain. Gulf Sustain is an initiative focused on driving dialogue and to advocate for more effective policies, ones that you're also advocating for here today, to address these cross-cutting issues across the GCC region and beyond. So I was just wondering, what advice from your medical background and health perspective, what advice would you give Gulf Sustain in preparation for their future engagement? What would the advice be, and what do you hope the health and social care system will have achieved for workers in the years ahead?
Right. I just right off the bat, access to healthcare and preventive healthcare, primary care. This is really important. So this needs to happen at the government level, but it also needs to happen at the, with employers and businesses. It's important to know that, Sarah, the government is really heavyweight. For them to go over all these different regulations and produce a regulation, it takes so much time and effort, and usually underfunded, and it takes years. but businesses are slim and fit. They can move fast. They can have all these quick fixes, if you like, and they can lead the way for governments to then follow. I think businesses have a great opportunity to honestly be on top of the occupational health and safety preventions, better than the government, put better standards than the government, put better standards for heat, for example. So there is a lot of effort that the employers can do that is cutting edge. There isn't anything that could prevent them from doing this. And they are easier to implement for them as opposed to a government having a whole different levels of interventions.
Right. Well, we hope that the businesses listening in will take on that advice, rather than waiting for someone to provide the solutions, to really go out and seek them based on the science, and hopefully with, you know, better protection and more and safer environments for workers. As a last question from me, to end this on a positive note as well, are there any developments within the health climate nexus space that give you reason for hope in the future, despite so much uncertainty?
I mean, hope is the only thing that we have when we talk about climate change, and honestly, there isn't a lot being happening. I don't see a lot of things happening, but you know, one really good thing that made me personally, at least, hopeful is the Inflation Reduction Act here in the United States that the Biden administration passed. I think it is a cause for optimism, because finally we see gigantic investments in making serious transitions, like serious, towards carbon neutral economy in the US. And I hope that other countries now could follow with all these investments towards carbon neutral economies and getting away from fossil fuel, because that will eventually have better health outcomes.
Right. Well, thank you. We hope that also projects like Goal Sustain will give more reason to hope for the future. But thank you so much, Dr. Barak. It was a really interesting conversation, and I've personally learned a lot, and I'm sure the listeners have as well. Thank you for your time, and yeah, hopefully to more optimism to come.
Thanks.